So have you ever seen a menopause symptom checklist? Because if you haven't seen one, let me explain some things. Estrogen is protective. Estrogen is an important piece to your body, and it's not just for vaginal and breast health. It is for brain health. It is for your joints. It is for your muscles. It is for your arteries. It affects really every system in your body. And this is why your menopause symptoms might vary based on your nutrition, your belief system, your prior injuries, all sorts of things. So menopause is a very unique experience for each person, and the checklist exists because it is highlighting these are the symptoms of this particular system when estrogen leaves the party. Now, some of the haters of the menopause symptom checklist state that we have a negative bias towards menopause. And I would say, okay, we probably do have a negative bias to menopause. It is not a disease state per se. It is a transition in life. However, during puberty, if we were to give a checklist, it is not all unicorns and rainbows. It is oily skin, oily hair, acne, body odor, poor proprioception and body awareness, their emotional outbursts. We can make puberty the same checklist and not state positives, and people will be like, yes. So menopause is not a disease state. It is a life transition. But what happens is because we are living longer, we are different than when we originally were kind of roaming the earth as hunter-gatherers. We now have more technology, and we're going to have to modify our lifestyles to help us be the most effective versions of us now that we have all this technology. And this is where it's an interesting, nuanced situation about menopause symptoms, because we're going to have to change how we do some things to help us feel better as estrogen goes down and leaves. What are we going to do to support those systems? Because some of these systems were optimized with estrogen in place. Now, our body was meant to go through a transition. We were meant to go into menopause, and it is a natural process. And we have testosterone that comes up. There is a positive of a hormonally more balanced postmenopausal. You don't have those up and downs before your period. You don't have the symptoms of periods like you once did. You don't have to deal with bleeding. You don't have to deal with getting pregnant. You don't have to worry about being pregnant. Those are the consistent pros of menopause. But the cons of menopause is that you have an increased likelihood of a couple other diseases or things that will creep up on you if we don't do prevention to preserve the different systems. An example is that I know most people know is you are much more likely to become osteoporotic when you are postmenopausal, because estrogen has everything to do with how your bone is going to build and remodel. And so HRT helps fight off osteoporosis, along with weightlifting, moving your body, mobility, vitamin D, and calcium intake within your diet. So we know osteoporosis is a disease state that is brought on by the hormonal transition of menopause. And so us talking about menopause, helping women identify their symptoms through a checklist, helps us know what level of education, what level of proactiveness we need to be doing for ladies to help future them. And this is where the conversation is a little bit funky. The reason a menopause symptom checklist is important is it helps us educate women and helps us determine where women are in that perimenopause menopause journey without having to do a blood test. But we can confirm if you are postmenopausal or nearing menopause through blood tests. But if you are early stage perimenopause, it's a little more difficult. But the menopause symptom checklist is a helpful tool because many women didn't realize that all those things tied in with menopause. They know about hot flashes in the US, and they know that there is a cessation of your period. They understand that, but they didn't get that all these other symptoms were attached. And I really don't believe women are over-reporting their symptoms of perimenopause and menopause. Joint pain, fatigue, and irritability are common with other things, but they absolutely do happen during perimenopause. because estrogen is neuroprotective. And during perimenopause, your hormones aren't so smooth anymore. They're quite erratic. So your irritability could be due to the fact that you feel lousy, but your hormones aren't very steady, and you might feel like you have some outbursts, especially before you start your cycle. The fatigue happens because your motivation is low, because estrogen helps us stay motivated, and estrogen is protective and helps us broker cortisol and helps us with inflammation. So you do feel fatigued because you kind of feel like rubbish. And the joint pain we know happens because estrogen helps us with our muscles and with our joints in the remodeling process. So you are going to be a little bit stiffer. You're going to have a little more soreness after workouts. And this is part of perimenopause. And this is why this is on a checklist for the educational purposes. So the menopause checklist, yes, it's to help the provider understand where that person is on their menopause journey, which is not a disease process, but it also helps educate the person doing the checklist. It is quite possibly validating to that woman who thought she was losing her mind and thought she was just crazy. Little did she know that all that stuff tied in to her hormonal imbalance. And for the people that state the menopause checklist and the way we talk about menopause in the US is too negative, I would like to add some positives to that list. But those positives aren't going to be like what you think. Those positives are, you can stand up in a room and say what you think. You're going to stand up for somebody because you know who you are and you've dealt with people that are jerks. And so you are brave, you are bold, and you don't give an F. And so you are going to battle. You also don't have to worry if you are postmenopausal about getting pregnant. You don't have to worry about the symptoms you used to have, PMS or PMDD, because your cycle has ended. You might have less migraines because your migraines were attached to your hormones. So we could put on that list. Do you have less migraines? Are you having less PMS? Are you having more PMS? Because less PMS would be postmenopausal, more PMS could be perimenopause. So this is why we do need the negative in that checklist. So we can add in a positive, but I don't think the medical world wants to see the positive of perimenopause and menopause because you can't measure that. It's a feeling. It's an attitude. There's been so much medical gaslighting with women for when they go to the doctor to report their symptoms that they are minimized for their symptoms. So I don't even want to fight about a menopause symptom checklist. I want that checklist so that a woman can sit there and have her epiphany and realize that she's not crazy and she's perimenopausal. And then there will be a moment of grief because they haven't started that mental preparation for that journey yet, because it is a hard feeling. To go through change is hard, but you will learn how to adapt and roll with it. So the checklist can be a moment for some people. And in my clinic, when I'm screening women for perimenopause and help them understand what perimenopause looks like, there is a moment of shock, disbelief, outrage, and frustration. But then we deal with the things and they do just wonderfully. But it's a phase. It's a real phase.